Hi, this is Medician, How to Learn Medicine channel. From the previous video, I have demonstrated why you are learning medicine the wrong way. Today, I will show you how to learn medicine in a much more efficient manner. Again, let me re-emphasize this. You have to get the concept right before doing anything else. That is the most important thing. So please go back and see the previous video if you haven't seen it. Now, take a look on the left side. This is a study pattern I just showed to you in the last video. A really scattered and disorganized method. In this video, we are focusing on the right one, a straightforward and successful style. This study method, which I call PULQ, stands for Problem-Utilized Learning and Questioning. It is one of the most important core techniques to learn medicine, but totally different from the one you heard, problem-based learning, which is often abbreviated as PBL. If you have watched the earliest video when I talk about precision medicine and medical textbooks, you knew that the only thing precision medicine and medical textbooks gonna do is to explore your brain and nothing else, if you misuse them. I have also mentioned that some people have recognized this problem and promoted a solution called problem-based learning. However, if this PBL method is working, why are we still struggling learning medicine? And here comes the answer, followed by another question. I want you to pay attention because this is so critical. What if I tell you the concept of PBL is absolutely correct, but the method it uses are completely wrong? Do you know where is the problem and how are you gonna fix it? Alright, let me show you an example. This is one of the common PBL cases you may see. I cut some contents out just to make it short. In this case, it presents you a 40-year-old African American male with chronic cough, which is associated with the erythema nodosum, and the CT chest showing enlarged hilar lymph nodes. A classic case of sarcoidosis with 3 important discussion questions, right? Unfortunately, this is not the real way medicine learning should be. Now, let me show you a good example of a sarcoidosis PULQ. It should be like this. A simple case with very detailed questions. In this case, there are 20 questions associated with the sarcoidosis. You can pause a second and take a look. This is what I call the comprehensive case study so that you can learn from top to bottom. And only by doing this kind of exercise, you can really learn medicine. Again, this is a PULQ, a problem-utilized learning and questioning method. It simply represents the natural way how people learn things. You encounter a problem, utilize the problem, and learn from the problem. However, you also question the problem itself and even generate a new question in the end. For each PULQ case, the final question will always be like this. Can you generate a classic case by using the knowledge you have learned so far? Let me explain to you what will be the advantage if you start to learning medicine using PULQ. First, while you're answering these very detailed questions, you start to question about whether each word in the case presentation means something. Are those things such as age, gender, or race relevant? Are those positive physical, lab, and imaging findings useful? There are 2 good byproducts associated with this training. One is that it will help you systematically put all the relevant buzzwords together. And buzzwords are extremely important because of limited time during exam. The other one, the answers to the questions are also so detailed enough to help you the real-world practice. Second, because of the detailed training in PULQ, you would be able to identify and summarize the important points that you really need to remember. Also, you'll realize that you're extracting key parts from medical textbooks. This is what I mean by avoiding reading the whole textbooks. You only extract important pieces from textbooks so that you do not need to read the whole book through, and then put them back into the bookshelf again. Third, the final step, by challenging you to create a case, you now need to use all the relevant knowledge that you have learned so far to generate a question. This is one of the most critical exercises that will help you to strengthen your memory. In addition, you'll start to know what were those people thinking when they wrote exam questions. Once you start writing the case, you'll learn to think what to write down in a case with accurate and related clinical history, physical exam, and laboratory results. You'll also start to think what will your questions be and what you want to ask. What would be the easy questions and not so easy questions? Then you'll understand those questions that are not easy and a little bit hard. Yes, those are the exactly questions you will get on the exam. So, starting next video, I will teach you how to practice PULQ. This is Medician, How to Learn Medicine channel.